We're going to move on to our panel discussion to wrap up this session. And as I mentioned, Dr. Simpson, Dr. Chu have joined us. Dr. Chu, as I mentioned, left medicine as soon as she graduated, and for some of the same problems and reasons that we're here today, and she's been doing some coaching of other physicians. So welcome, and we're really interested to hear what you do, and I think she's going to have some questions and some discussions with our panel.
Thanks, Mike. Yes, my name is Lisa Chu. I do have a medical degree. I graduated back in 2001 from University of Michigan Medical School. Very traditional place. They didn't know what to do with me at the time when I said I was going to leave. And yeah, I saw a lot of unhappy people around me and lifestyles that I didn't really want to replicate. And so I chose to go out into the world and gather experiences and learn from my life. And so since medical school, I've been in the finance world. I've been an investor in medical device technologies. I have also been the owner of my own business, started a violin school in Silicon Valley, so dealing with what I considered my patients, but they were the families of the children that I was teaching. And now, in the last 5 years, I've been doing life coaching, which is a totally new field, and actually for me, it was a new field at the time. And I'll be demonstrating that later in the week, actually live on Friday with Judy, to just show you what that is, because it was totally new to me when I first was exposed to it. And mainly my coaching practice has been with physicians who have been going through burnout or other kinds of either forced or chosen career transitions. So what I have to offer is not really the in-the-trenches day-to-day experience that you all have dealing with these problems, but I have the experience of reinventing myself and dealing with the leaps of courage that it requires to do that. And really what I see happening for physicians right now is a call to make the leap of courage and faith that is calling to you. And I just have to say, for those of you who were not on the first session today, Michael burned his medical license on camera. Hello, I had to tweet that. That's huge. And I think it speaks to one of the themes that you all highlighted that came up in every talk yesterday and is in some form in every talk today, which is about participation. That somehow we as physicians consented, unconsciously or consciously, to this, to get to this point in our evolution. And in a way, this is our battle cry to say, no, we're not going to consent anymore. And I love the symbolism of burning your license. And I have to ask the question, I'll just ask the first question. Michael, are you calling for a revolution among physicians?
Well, I'm calling for, and our whole movement is calling for the practice of medicine to be returned to those who are trained and licensed and experienced in practicing medicine. I mean, there's a reason that we train for 7 more years to do this job. And it's an extremely rewarding career when it's done right. And when someone else outside is controlling what's happening and not taking any of the responsibility in case things goes wrong, then it becomes extremely unrewarding. And so there seems to be an idea among government and third-party payers that medicine is something we can practice in our spare time after we go through 130,000 pages of Medicare regulations and things like that, and that's just not the case. So I hope that other physicians who feel this way, and I know there are many, I've talked to many of them over the past year or more, will also step up and say what they have told me in private.
What will it look like, and this is for anyone on the panel, what will it look like, because I feel that we've seen a lot of examples of stories in the last 2 days of leaders who have stepped up in their own way, doing something new, presenting a new idea, adding their voice to a conversation. So for the viewers that are watching this, what are some of the ways that they can actually participate, step up, engage? We've mentioned writing to Senator Cassidy. What are some other specific actions that you can imagine for physicians who are watching at home?
Let me just say real quick, and I'm glad you brought that up. Something we failed to mention yesterday is that we have a resolutions, documents, and polls page. If you go to letmydoctorpractice.org, scroll down to the middle of the screen. We have a resolution on EHR and meaningful use. We have other resolutions that have been sent to us by other physicians, and we'll have those up later today. And we have an H&P on the state of American medicine that can be edited on wikidoc.org. And then we have a poll written and conducted by Merritt Hawkins and the University of Tennessee. So that's one area. By all means, we urge people to send in other resolutions, documents, and poll questions. I want to turn to Cedric for a minute. Welcome.
Thank you, Mike.
And do you have anything to add at this point?
Well, I think the burning of the medical license is a big statement in that, you know, the majority of professionals that I know of, and of course that you know of as well, are unhappy with the state of medicine as it is today. And so, I thank you for inviting me to this forum or the town meeting in order to, in one, experience what the rest of the physicians are experiencing, but also two, to speak up and say that I think that we can do better, and there can be a change. And I don't know what the specific answer is or where we're headed, but I do believe that we still have the doctor-patient relationship, which is first and foremost in medicine, and it seems to be decreasing in importance due to guidelines, regulations, and factors outside of actual providers, that are actually practicing the medicine. So I'm here in support of the conference and to see what ideas come forth in order to effect a change.
Okay, thank you very much.
I think you asked the question, what specific things can we do? And probably a few things. One, I think starting from the basics, hold on to the values that you hold dear. We all took a Hippocratic oath, don't compromise on it. Whatever that means to you and whatever thing you do day to day, don't compromise on that. Two, we can inform our patients about what we're going through as physicians. I think that's a big step. I think we can inform our hospitals and our hospital administrators that what we need as physicians, and then we can speak out. And I think, and it's interesting, you said, Michael, that you were told things in private. I'm going to turn to you. Why is that? Why do people feel intimidated to speak about this? Is the medical profession, I'll throw it out there, gutless? Do we not have any courage? What's the secret? Can't we just inform people and be honest with what's going on? So why the secrecy? Or why the lack of activism by the medical profession?
Right, I've wondered the same thing, and the first place I ran into that was at the VA. And I went to talk to one of the older physicians who'd been there a lot longer than I had about these problems, and he closed the door and whispered to me. And then I had that happen again with one of the directors there. And I just thought, my God, what is going on here? I thought we were free Americans and had freedom of speech, and why this unwillingness to speak out? Now, since we've started this effort, there have been many doctors who have voiced the same concerns, and yet when it comes to speaking out, to participating in the town hall, to voicing, they're silent. And often when I ask them why that is, they remain silent. So there are a number of reasons, but I think if we want to be true physicians and surgeons, then we have to break that silence. Or we're not that anymore. We're a provider, whatever that means.
I'd like to speak to the question. Human beings resist change, and a time for change has come. And this change requires courage, vision, responsibility, accountability, persistence, and I could go on. And all of these are human qualities that require energy, time, energy, money, but really require us to change our daily behavior. And Lisa asked, I think I heard you ask, what can the day-to-day physician do? I think that each one of us should begin by looking at ourselves, and we should take an inventory of what are our strengths and what are our weaknesses. And there are very clearly defined mechanisms for maximizing your strengths and minimizing your weaknesses, and go to work day by day, step by step, becoming a stronger person and minimizing whatever your weaknesses are. Yesterday, Dr. Michael Kurachek, one of our speakers, just so very graciously, time and time and time again during his presentation said, you can do this. You are smart enough. You need to get involved. You must lift the hood of the vehicle that you're a part of and learn to understand how it works. I've said this before, so I'm repeating myself, and we've all heard these words. Physicians are known to be like herding cats. Personally, I think that that's a matter of convenience. You know, we are compliant as long as we're doing what we want to do. Well, what do we want to do? We want to practice medicine. We love practicing medicine. It's a very fulfilling thing for us to do. But circumstances call upon us to do new things now. And I think that those changes that have come upon us have brought some angst. And I think that that angst is visible to you. And probably by working as a life coach with physicians, you've helped people clarify, why do you have angst when maybe you have every reason to have courage and boldness? And let's take that coin and flip it over and take you from a victim to, my words are, an owner and manager. I plan to move from delegated laborer to owner and manager. That's my goal.
Beautiful. And I'd love to just speak to that in terms of some of the comments we were getting from that were kind of recurring today were about fear of abandoning patients, Medicare patients. What do we do with our elderly patients? And that's a great example of how that the framing of it as fear of abandonment comes from a certain mindset that was the old way, that we have to do it a certain way. And we heard from every speaker that there's actually, number one, when you actually stand in your truth and be the owner, be your own authority, that you don't lose the patients. They don't see you as abandoning them. But it's, if we can do the work in ourselves of finding our own courage and seeing this kind of, when we step up and actually take authority for the way we desire to practice, we are not abandoning our patients, we're actually taking a big stand for them. I love the message of the first session today, which was, if you can't find a reason to do it for yourself, do it for your patients. Because actually, all of these positive changes that you make for yourself, making your ease of practice
to Dan,
better, benefit your patient ultimately. That's really why we're here. That's what I keep hearing also, that we're not just, there's a public perception that, why there's not going to be an advocacy group that comes up for physicians because we're not disadvantaged in society in the kind of classical sense. And yet we are the front line person who knows what the patient-doctor relationship is, and we're the advocates for the patients ultimately in this whole movement. That's really what I'm seeing. So maybe we can speak to that, because I think that this message is something a lot of people can get behind. But what are the real fears? What are the concerns, hesitations that any of you might be feeling as you envision this and talk about moving forward in it? What are some of those real concerns that you have?
Gentlemen have.
Well, I wouldn't. For me, I don't think in terms of specifically considering opting out of as an orthopedic surgeon, Medicare or insurance, I wouldn't frame it quite from the perspective fear of abandonment. I take it and look at it from the patient's point of view, that I realize there's a lot of senior citizens who are on a fixed income. And so if I opt out of Medicare, you know, I might be limiting access for those patients, right? So that's a different way of looking at it. It's not my fear. I'm looking at the patient and say, what am I doing to them? Am I going to limit their access? Now, there are others on the other side who say, you know, they can afford it. Some people can afford it, and so take the step. That's a reasonable argument. But I look at it that way, not my fear. But what am I doing to the patient? Am I limiting their access to me as a Medicare provider?
And is that a concern of yours as you envision your own practice?
Yeah, you know, I've considered going forward, should I opt out of some of these things, but I'm in a pretty small town in Santa Barbara. There's a lot of elderly patients there. And so for sure, I'm sure that would definitely limit access to some of them if I chose that, if I chose to opt out of Medicare.
No, I would say that it was a tremendous fear for me to make that leap into direct primary care. And it took several years. And in 2011, when I left the VA, I did try a cash practice. I didn't have a model to go by. I just was trying to make one up and find my way. And my sister had a terrible health problem just as I was starting, and my father, elderly father, had some problems. So I never was able to spend the time to learn how to make it work. And also, I tried to kind of bridge that by doing some part-time work in a nursing home. And what I found was I had all the same problems, all the same time and money inputs, doing it 1 or 2 days a week as I would have full-time. So it didn't work at all to do that. You just had to cut the cord and make that leap. And I have to say that I'm really glad I have, and it really has changed my whole outlook from doing that. Something Cedric and I have discussed is an adage that I live by that says, choose the path with heart. So the advice was, for any path you might take in life, traverse it for as long or as many times as you may need to determine if that path has heart for you. And if you determine that it does not, leave it behind and never look back again. And so what is the path with heart? The path with heart is a path that, as you traverse it, makes you feel stronger, more alive, more energetic. And the path that doesn't have heart for you makes you feel the opposite. So I would say that to physicians. You know, if you've been down this path for years and many times, and it's having that opposite effect for you, maybe that path doesn't have heart for you and never will.
Beautiful.
I'd like to speak to what you said too about the fears of the change or the coming change in medicine. And I guess it's about 10 years ago now, I decided to stop, opt out and stop doing Medicare in a small town of Las Vegas, New Mexico, and changed. I stopped going to the nursing home and stopped admitting patients to the hospital because I was no longer on backup call, because I read the bylaws and changed my designation from primary care doctor to a specialist, since I'm a board certified internal medicine doc per the bylaws of the hospital. So, and I gave them 6 weeks, and in that period of time, I told my patients and that I'd still be here, that I was changing my practice model to just cash or trade or barter, and I would charge them $25 for whatever ails them, $50 if they made me fill out paperwork. And there's a few things I found out when I did that. First, a handful of patients were upset because they said that I had abandoned them in this small town. Though I had not gone anywhere, I just needed to change my practice model. They were quite upset about that. Second, the care for which I provided before, when I accepted insurance for I'd say a 99214, and everybody knows what that means. It's a code for maybe an intermediate visit with a couple medical problems. I think our charge was maybe $108 at the time, Now that I had a charge of $25 for whatever ails you, that care was appeared to be devalued by the consumer or the patient. So they were wondering why the cost was so cheap now. And so that was a deterrent to a lot of patients. You know, if Dr. A, B, and C are charging $110 for that visit, and then you charge $25 for that visit, because it's America and we're consumers, there was a good faction of those people that felt the value that, you know, of that visit was not to standard. So that was another thing. And last, I found that my patients that did carry private insurance and Medicare insurance, now that I was charging them cash, wanted care that was outlined and designated by the insurance company or by Medicare. So it wasn't enough to say, okay, this visit will be $25. You do have strep throat. We plated it out. And now you need penicillin. Well, it better be the penicillin that was covered by their insurance company. So then you still have to go back to what are the guidelines and procedures for the insurance company in order to get them the treatment that they need. So I just wanted to speak to my experience in that.
Thank you. We have a comment from the chat, which is the first is that I used to think the AMA and my specialty society would advocate for physicians like me. I was wrong. So can we speak to, and this kind of touches on the examples that I've seen over the last 2 days that we've shown are really individuals who stepped up outside the boundaries of big organizations and have done something on their own, and really everyone at this table is doing their own version of it. How much of this call is about asking physicians to not depend on groups to advocate for them, and to ask individual physicians to come into their own voice, maybe, and anyone, and collaborate around having their own voice together.
I'll take a shot at that, and I'm sure, you know, well, I think one thing to keep in mind is individual physicians, you know, we're just like everyone else, right? Everyone's going to come from a different background, a different perspective, different specialties, but I think as an individual, you know, to have the courage, like we were just saying, to kind of speak for yourself. But when I look at it from a medical profession standpoint, I do think, and this is where we might get into some disagreement as a medical profession, I do think for the benefit of our medical profession, for the endurance of physicians over time, we do need one organization that would promote physician unity and speak to the speak on behalf of the physician for physicians in general. I do think we need that, so I'll just let it go at that. Yeah.
I was struck by an email stream between Dr. Strickland and Dr. Stephen Stack, president of the AMA, not so very long ago. And if I recall correctly, I believe that Dr. Stack said to you that the information that we were promulgating about the AMA was not true. Did I read correctly?
That comment had to do with the statistic that we've been given that the AMA makes approximately 80% of its money from its ownership of the mandated and of the mandated CPT procedure codes, and only 20% from its membership dues. Dr. Stack did not dispute that, but disputed that that fact made the AMA less interested in its membership and growing its membership. And in fact, in the great fall in its membership in recent years, from a maximum at one time of 75% of American doctors now to less than 20%.
Do I remember reading that he is very interested in serving and representing the working physician?
Well, I don't know about that specifically from the email list.
Yeah. I think that the AMA showed an interest in representing working physicians. with their Cut the Red Tape webcast last night, which anybody who didn't watch, I would encourage you to watch. I would also encourage you to, I'm not sure that I'm making a proper connection here, but support the AMA by being in contact with your elected representatives, so that whatever's going on in Congress right now has more and more physician voices behind it. We've discussed multiple times in round table conversations, I believe that that a single voice is necessary to represent physicians at a national level, in part because we do, at least today, have Congress to deal with, we have a president to deal with, and we have some very powerful lobbyists. And individually, our voices get lost in the wind.
I want to say one thing. I did make the proposal to the AMA, and I would extend that to any other physician organizations listening or participating. And that was to make an offer during this conference for new members to join at a half price rate for 1 year. That would give those who have left the AMA for whatever reason, a reason to try it again, come back. And that would give the AMA some money, but yet a reason and a long enough period of time to show these people that there's a reason for them to come back. So I hope any organizations would consider something like that. I do have a question here from our viewers, but I wanted to address one thing that Cedric brought up. When he tried his cash model and encountered those problems, the first cash model I tried was similar. It was a $50 flat rate per visit. Did not seem to work well, and I never had time to explore it or try to make it work because of those other issues in my family. But I really like the model I've gotten from Dr. Josh, which is just a simple monthly membership. Now, Josh is a family practitioner. He sees kids, so that starts at $10 a month. It goes up through the age ranges as much as $100 a month for the oldest, well above 65. For myself, I start seeing people at age 13, $25 a month, and again to 100 up through the age ranges. That has worked very well. The patients know what they're going to spend. They know they have 24/7 access to their physician. They save tremendously on labs, medicines, and imaging. As he said, we get labs and medicines for pennies on the dollar and pass those on at cost. MRIs up the street from us are $395 cash, including the reading, whereas at the local hospital they're up to $2,400. So that model gives the physician a known income, a steady income, and gives the patients advantage as well. And I think it seems to work better than a per visit model. This comment from Dr. Jean Dorio says, business has taken over medicine, and I'm a pessimistic physician, and we'll find a new direction out of this quagmire. Insurance companies deny, and hospital administrators are bullies. Don't call on them to make these changes, as they are the profiteers. Turn to the public through the media and a united voice. We can do it. Even if it only takes one person, stand up. Thank you, Jean.
There's one more question over here.
And this was just an extension of the other comment and a continuation. It says, we as doctors do not have a united voice regarding the basics, like advocating for a strong doctor-patient relationship. From Stephen Croft.
One thing to just ask as I'm thinking here is, like, when you start to think, like, who are all the different players in healthcare, right? So we have the patient first, physician, we have powerful pharmaceutical companies, and we have hospitals. And when you look at the hospitals, they're represented by their hospital association, huge, a lot of them there, right? With a lot of power. Pharmaceuticals, you could say the same thing. And so the way I look at it, and it might be not the correct way of looking at it, if we're dealing in that type of healthcare environment, there's no way we as a medical profession can win. There's no way we can speak and have people listen to us on Capitol Hill with any kind of authority, because we do not have the numbers in a single organization to make our point. And that might not be the correct way of looking at it, but that's how I kind of envision it. Thoughts? What do you think? Cedric, what do you think?
You know, I think it's difficult. I think that I think we do need a single voice, and as we were talking yesterday, I think part of the design or part of the training is one of the competition to be essentially top of the heat, and you know, I think professionally and we're fractured in that sense, and I think we do need that common voice and a common goal, and if it's just that we maintain and preserve the doctor-patient relationship, then I think that's something that everybody can get on board with, and then let everything else, you know, follow after that. So.
Okay, well, that about wraps it up for today. I did want to throw one quick thing out there that we tried to work into this day of alternative practice models, and we're not able to find someone to speak on it, but foreign opportunities. I heard of one physician who was working in the outback of Australia, American doctor, worked 6 months out of the year and made $250,000 for that. Of course, there's medical tourism you hear about in the Caribbean and India and various places where you have a new hospital or clinic, you have American-trained physicians or high-quality physicians, and people are going overseas to get some of their care. And we tried to find some opportunities there for American doctors to explore. We're still throwing those out, and we'd love to hear from anyone who has done that or who has such an opportunity to discuss with American doctors. Thank you so much for joining us today. This session will be rebroadcast at 7 p.m. Eastern today. Thank you.